Coughing up blood may be a sign of bronchitis, pneumonia, blood clots, or cancer. If you are coughing up blood, it is important to find out where the blood is originating. A small amount of blood from bleeding gums, a nosebleed, or a cut on your mouth may trickle down and irritate your throat, causing you to cough it up. Or the bleeding may actually originate in your lungs, which suggests the presence of blood clots or an infection, possibly tuberculosis. Also, you may have an abnormal growth in your lungs, possibly cancer. You need to see a doctor immediately for evaluation and appropriate therapy. A thorough examination of your mouth and nose, and even looking into your lung with a tube, may determine the cause of the bleeding. X-rays and scans of your lungs may also be helpful.